Dermal fillers come in a wide variety, but they're all semi-liquid, semi-solid, injectable materials. They get injected just underneath the skin, sometimes in the subcutaneous layer too, which is the fat layer. And the most common way they're used is they improve wrinkles, folds, or depressions just by lifting up the wrinkle area. They're also used for general volumization, so you can inject these fillers throughout the entire area of the face. You can inject them in, say, one cheekbone and the other cheekbone, and that adds general volume or general projection of the cheekbones, which is a more youthful appearance. The third way they could be used is in lip augmentation. So if you want to enhance the shape of the lip or increase the size of the upper or lower lip, that's a nice indication for dermal fillers. There are many different types of dermal fillers. You've probably heard them in advertising. There's Restylane, Juvederm, Sculptura, Radiesse. These are all safe products. We use all these products. They're all effective, but most patients usually end up with choosing one or two products and they stick with those products. The main difference is that the products will get degraded by your body at different time points. So some products will be gone after 3 months, some products will be gone after 2 years. That's the most important thing you have to discuss with a physician before you choose the product. I tell patients a dermal filler is like going to a doctor and just getting a small shot, because it does require a small needle, but it's an extremely small needle that's used, and we use things like ice, numbing medication. Dermal fillers have very minimal recovery time. Most people can have an injection done at lunchtime and then return to work that same day. Dermal fillers can't replace facelift, brow lift, or eye lift, because those are actual surgical procedures. They can complement the surgical procedures, but a facelift is a traditional procedure that uses stitches and actual incisions, so it's a much more powerful, dramatic effect. The filler has the advantage, though, of being less invasive. It's more affordable, there's less downtime, and there's less risk of complications. So those are the advantages, but they're quite different than a traditional facelift. One treatment with a dermal filler will produce a noticeable effect on that first treatment. However, ultimately or eventually, the material will degrade or it will get resorbed by your body. And at that point in time, you need to have a redose of the product. This can depend on the type of product that's used. So if you have something, for instance, like Restylane, that would degrade after about 3 to 6 months, and then you need a new treatment, or you can make that decision at that time. A product like Radiesse may still be around at 2 years. So that's a conversation you'd have to have with your physician to determine what's the right filler with the proper characteristics.